I am Sridharan, Assistant Professor from the SNS College of Physiotherapy. So, in this video, we're going to see about the topic which is based on the electrotherapy, known as cryotherapy. So, in this video, we're going to see a detail about the cryotherapy's definition, biophysical effects, Lewis Hunting reaction, and as well as also the clinical guidelines about the cryotherapy. So the cryotherapy definitions and the mechanisms are the cryotherapy is a therapeutic cold application aimed at reducing the tissue temperature to achieve the analgesic and the anti-inflammatory and as well as also the metabolic effects in the clinical setting. The biophysical tissue effects of the cryotherapy are it mainly helps in the vasoconstriction. So due to the vasoconstriction, it also decreases the nerve conduction velocity and as well as also the metabolic slowdown, but the underpin cryotherapy's therapeutic effects on the tissues. The Lewis Hunting reaction and its significance are the initial vasoconstriction followed by the vasodilation, which mainly helps in the critical for tissue reperfusion and the as well as also healing during the cryotherapy. So the clinical indications for the cryotherapy are it mainly uses in the acute injuries, inflammations, post-operative pain, whereas these kind of cryotherapies optimally supports the recovery and the symptom management. The contraindications and the safety measures are the contraindications include cold hypersensitivity, vascular insufficiency, and the impaired sensation to ensure the safe and appropriate cryotherapical use. The clinical decision making by applying the cryotherapy or integrate the theoretical understanding with the patient assessment to tailor the cryotherapy interventions effectively in the physiotherapy and as well as also in the medical practices. The cryotherapy applies the cold temperature to the body tissues to induce the physiological effects such as pain relief, inflammation reduction, and the metabolic rate, which decreases in the injured areas. The cryotherapy also helps in control the edema as well as also reducing the inflammation and also the elevate the muscle spasm and pain, improving the recovery outcomes after the injury. The localized cryotherapy includes the ice packs and the cold spray targeting the specific areas, while the whole body cryotherapy employs the controlled cold chamber for the systemic effects. The biophysics that comes behind the cryotherapy or it's according to the conversion of the heat. So generally the heat is transferred by the conduction. So this conduction is the method of heat transfer from which the heat away from the skin and the tissues through the conduction, essentially for lowering the tissue temperature safely and effectively. The vasoconstriction response, which shows the cold exposure, causes the blood vessels to constrict and as well as also reducing the blood flow and limiting the edema formation and the critical for managing the inflammation. The cooling decreases the cellular metabolism and as well as also lowering the oxygen demand and minimizing the secondary tissue damage during the injury and recovery. It also slows down the nerve conduction velocity, which produces the analgesic effect that helps in the alleviate the pain in the treatment areas. The temperature gradient control between the cold source and the tissue dictates the depth of effect. The controlled exposure prevents the frostbite and as well as also the tissue injury. Decoding the Lewis Hunting reaction to the cold exposure is initially it causes the vasoconstriction. So due to vasoconstriction, the peripheral blood vessels constrict, which causes the reduce in the blood flow, and it also minimizing the heat loss during the first minutes of the cold exposure. And intermittently, it shows the vasodilatation. So vasodilation approximately 5 to 10 minutes where the vessels dilate periodically to restore the blood flow and as well as to prevent the ischemic tissue damage. And continued by the cyclic response. The cycle of the vasoconstriction and the dilation repeats, maintaining the balance between conversion of the heat and protecting the tissues. Finally, by implying in the clinical aspects, understanding this reaction guides the cryotherapy duration to maximize the benefits while avoiding the cold injury risks. The clinical indications for the cryotherapy are first we're gonna applying for musculoskeletal trauma, which have been occurred within the 48 to 72 hours to reduce the swelling. And afterwards, we can also apply for the post-surgical inflammation, which helps in promoting the tissue healing faster. Thirdly, we're gonna applying for the soft tissue injuries, So while applying for the soft tissue injuries, meaning it mainly helps in the reducing edema and as well as also pain. Finally, we can also apply for the acute inflammatory conditions such as bursitis and tendinitis to decrease the inflammation, and also it provides helps to provide the analgesic effects. And it also helps in the treating for the neuropathic pain selectively, where you can use the cryotherapy in certain neuropathic cases which alter the nerve conduction and as well as also improve the pain control. So that's all about the cryotherapy. So see you on next video with some other topic. Thank you.